Welcome to the True Hope Cast podcast, where we take a deep dive into mental health's many physiological and psychological aspects. This is the show for you if you're looking for motivation, inspiration, knowledge, and solutions, and that's what we're all about here at True Hope Canada. True Hope Canada is a mind and body-based supplement company dedicated first and foremost to promoting brain and body health through non-invasive nutritional means. For more information about us, you can visit truehopecanada.com. Today on the show, though, I welcome Megan Bliss. Megan is a private, high-level health consultant based in Utah. She works with stay-at-home mums, athletes, as well as very busy professional working mums like herself. As an integrated medical practitioner and board-certified family nurse practitioner, Megan brings nearly 80 years of experience working in the health industry virtually to those people who need it. Megan's passion is not only helping women stuck in hormonal chaos, but also helping health-conscious people take their health to the next level. She wants her clients to have a deeper understanding of their bodies and its unique individual needs. Today on the show, we're going to be discussing optimal female hormone balance. Enjoy the show. Hey, Megan, we're live. Hi, welcome to the show. Thank you so much for being with me today. How are you? What is going well?
I am so good. Family as well, life as well. I mean, all is well because I've been taking care of my health. So all is well. And I am just happy to be here. Thank you for having me.
Wonderful. Well, as an intro, can you just let us know who you are and what it is that you do, please?
Yes, I am a nurse practitioner. I've been a nurse practitioner for over a decade. And I initially was in family practice doing the run-of-the-mill family practice issues, but I noticed I wasn't able to make the difference that I wanted to in that model. And then I really started, and where I am a female practitioner, women tend to gravitate towards me to discuss their concerns mentally, physically, all of that. And I just was not given the tools to be able to adequately help them. So then I started taking more of an integrative functional approach and coming at things from a more holistic perspective and really diving into women's hormones because I found that to be a critical factor for us.
Cool. Why couldn't you make the differences and changes in people when you were a nurse practitioner?
So I feel like in just the standard education, we're definitely taught how to diagnose all of that. But then there's always a treatment protocol that consists of medications. It's like, okay, you've got this symptom or this disease, here's medication to take for it. So it was for me a very surface level symptomatic approach and not really getting down to the root of the issue. And I just feel, and I've spoken with a lot of recent graduates from med school, NP school, PA school, all of that. And they're like, yeah, we didn't get any hormonal training in school. It was just, if you have any issues hormonally, take a birth control or take some hormones if you are past menopause. And that's pretty much all that we're given in traditional schooling.
So that's wild. Why would you not be taught about hormones when it's one of the most, especially for women, one of the most complex, quite beautiful, amazing systems that affects every single part of your being? Why would that not be a huge part of your training?
Well, I feel like this is a very multifactorial. I feel like, so when I was in my schooling, it was, when did I start? 2010. And it was when I went into grad school, and the Women's Health Initiative had given the entire United States quite the scare on hormones and hormone replacement and all of that. So it almost gave this, we're not going to mess with hormones. We're not going to deal with hormones. They cause cancer, essentially. And so I feel like, and with any educational system in medicine, it seems to take a good 10 years for things to get into the educational system in order to start to be taught. And so I was very much in the post Women's Health Initiative that hormones cause cancer, which there has been a lot of studies to debunk that. And hormone balance is very, very important for our overall total body health.
Is there an interesting history there in regards to the use of, 'cause I remember listening to a podcast on Dr. Huberman a long time ago, but they discussed some sort of interesting history in regards to the use of hormone therapy, like back in the 50s or 60s, and it worked really well. And then there was some sort of scare where they took it away. I'm not sure. Do you know what I'm talking about? Maybe you could definitely describe it better than I just did.
Yeah, I'm pretty sure it's the Women's Health Initiative, because
Yeah.
they in that initiative they were given synthetic hormones, so your synthetic progestins and synthetic estrogen things, and they can promote cancers, these synthetic versions. However, if women are treated with bioidentical hormones, or they're getting down to the root cause of why their hormones are out of whack, then it's actually very cancer protective, and natural or bioidentical hormones can be very, very protective against cancers and heart disease and osteoporosis and so many mental health issues too.
And was there anything put in place when the cancer scare was there and they took they took the availability of these things away? Was it replaced with anything else?
Well, they didn't necessarily take anything away, because really, I mean, our oral birth control pills are still there, and they're not really there's not a regulation on them, even though there have been a lot of studies on the health disparities from these as well. So they weren't really taken away. It was just basically told that, like, menopausal women or just hormones are bad. And so it didn't take anything away. And then there really wasn't recommendation on replacing it, which is one of the reasons why I really started diving into the more functional approach, because I felt like there was just something out there missing. And then compounding pharmacies have been very helpful in training practitioners on the use of bioidentical hormones and natural hormones.
Cool. Yeah, we're going to touch on. I'd love you to talk about synthetic versus bioidentical, but I'd love, just as an intro, can you tell us what are hormones, and maybe why are so many women struggling with hormone issues? Because seems to be constant.
Yeah, and women can struggle with hormonal issues from before we start menstruating until way after menopause, obviously. So it's not that we only should care for them during our reproductive years, or we should only care about replacing them after menopause. We should be having good hormonal care throughout our entire life. We have hormone receptor sites over our entire body. We've got them in our brain, we've got them in our bone, in our skin, in our heart. And so we need these hormones. They are so promoting for good hair health, good skin health, for helping with our cardiovascular system. They help with the neurotransmitter connection in our brain. So I have seen a lot of women who are struggling mentally, that if we took care of their hormone health, whether it be just getting down to the root cause of it and fixing that root cause, and not necessarily supplementing with hormone replacement or anything like that, but really getting down to the root cause of it, that we can make such a big difference in their mental health, their energy, and then their metabolism as well. So it doesn't matter what age you are, but it can affect every aspect of our life.
What do you think is really important to understand about female hormone health? I mean, we spoke about that, it's not really taught significantly in medical schools to medical practitioners. So I'm assuming that it's not really dived into in a school setting for just for kids. That will obviously be very good information. I don't know to the depths of that information and the hormonal system in schools, but like, what do you think would be good for like everyone to understand, and not just women? Because I think it's very important as a husband that I should be knowledgeable as well. So what do you think is important to understand about female hormone health, and what's maybe missing in like that fundamental like school education?
I would say, and I fully believe that even our young teenagers need to have good hormone health education, because we expose ourselves to toxic elements on a daily basis repetitively, and so many of these things can affect our hormone health, and studies have shown that that a lot of things can have a significant amount of what is called endocrine disruptors. And endocrine disruptors are any external factor, chemical that can disrupt that endocrine system, which the endocrine system is our hormonal system in our body. And many of these endocrine disruptors come from our personal care products, our shampoos, our soaps, our menstrual care products can be a huge factor in it. And lotions, are the fragrances in our home, all of these things affect our hormones. And every time I see so many women going to a candle shop and they're like loading up on all these fragrance laced candles and all of that, I'm like, oh, I wonder how her hormones are. And then the downstream effect of that is, oh, I wonder how her moods are and how her sleep is and all of that, because it affects all of that.
And are you talking about like those xenoestrogens that mimic the function of our own endogenous hormones and how that's damaging? And I just thought about, so I'm aware of that, but it's like, so we obviously have receptor sites for these hormones, and these xenoestrogens coming in and acting as our own hormones. Why is that dangerous? Are they not just doing the job that our hormones should be doing? What's the problem with that?
So it's kind of like with the synthetic hormones. These anything that's not the actual hormone, I kind of think of it as a puzzle piece. And think about if you're doing this big old puzzle on your table, and if a piece doesn't fit correctly, it's not like the whole puzzle isn't gonna work. And so the way I think about it is these chemicals or these synthetic hormones are coming in, and sure, they might like get this part of that receptor site, but they're not getting the whole receptor site. It's not fitting in there perfectly, and it's not allowing the communication of the rest of the chemicals in our body to really do what they need to do.
Interesting. And if that xenoestrogen is replacing that receptor site, and then the hormone that's supposed to be there, let's just say estrogen, for example, is not getting there, does the body recognize that estrogen is not being used and downregulate its production? Does that happen?
Sometimes that can happen. Sometimes some people it does downregulate, or some people it's still cranking it out, and then you're not able to detoxify. You're not able to get that out. And then the kind of something that I think about in that aspect is if you've got too much of it and it's in your body, it's kind of fermenting. It's not fermenting, but that's the visualization I like to give myself. It kind of ferments in there and can get toxic and cause a lot of issues like really heavy periods or anxiety, depression, stuff like that.
And is that much different from the synthetic hormones and the bioidentical? Like
it's similar. Yeah, similar aspect there. Whether we get it from the synthetic hormones or those xenoestrogens, it can get in there. And then another thing that it does that I don't think a lot of women are aware of is if another visualization here. I think about a parking lot, going into a parking lot, and there's very limited parking spaces. And if we have too much estrogen or these synthetic estrogens floating around, sometimes they will go in and steal a parking spot that they weren't supposed to go into, like our thyroid receptor sites. So that's one of the ways that having too much estrogen or these synthetic estrogens or these xenoestrogens can affect our metabolism and our energy too.
Yeah, it's interesting in how frequently and so often we use synthetic chemicals in a very organic body that has very, very deliberate combinations. And we're talking about like receptors and hormones. It's like a key and a lock, and it's a very, very specific key. And you could mimic it to 99%, but it's not 100%, right? So it's interesting that we're kind of bound in a synthetic medical model where we're not, using our own endogenous production and putting our body in a position to, revamp, because it knows how to make these things. It knows what to do. So yeah, it's just an interesting conversation piece in regards to the further toxification, I suppose, of ourselves.
Yes. Yep. And I prefer to look at hormones from, I was taught a PTSD. So you're looking at the production of the hormones. Okay, what's going on with the production of the hormones? Why aren't they producing accurately? All of that. And then you're looking at the transfer, getting from point A to point B. And there's so many mechanisms that are necessary there, whether it's certain nutrients or whatever. And then you're looking at that receptor site, at that cell receptor site. It needs the right, I kind of think of it like a passcode, it's got it like a safe. It's got to have the right passcode in order to actually get in the cell and do what it needs to do. And then the destruction. So that's kind of the PTSD of how I like to look at hormones. So it's not just, oh, you're low here, supplement. There's so much more that goes into it.
What does a common hormonal imbalance look like?
So I feel that it starts a lot earlier than we necessarily really notice. Sure, our periods being irregular is a very obvious sign, but it can start earlier than that. It can start with irritability, mood changes, some depression, that type of thing, lower energy. And I mean, we do have these fluctuations in our cycles if we're menstruating, but when they're severe and noticing these big fluctuations in energy and mood, that's a big red flag. Skin issues can be a big sign. So obviously the acne, but then dry skin can be a big sign of hormonal issues. Yes, thyroid and our sex hormones too. So and then there's the obvious ones, like I said, our periods being out of whack, but then hair loss, and I call them our billboard symptoms. So hair loss, skin issues, and our weight management can be skewed.
Are there other conditions that are diagnosed when it's actually more than likely a hormonal issue? Because what you've described there, like a bunch of different symptoms, could be so many different things, literally dependent on the physician that you're seeing and how frequently they see something or what they go to. So it sounds complex. Are there like some more like common things that get misdiagnosed?
Yeah, I mean, if you look up how to diagnose depression, you can meet the criteria to be diagnosed with depression, and those same symptoms, can be a hormonal imbalance. And anxiety, same thing. Eczema can be diagnosed when it's more, if we treated or took care of the hormonal imbalance, it actually can help with the histamine response with eczema. So because estrogen and histamine response are very, very intertwined as well. So yeah, our mental health issues can be a big thing that is often overlooked. ADHD symptoms, inattentiveness can be hormonal imbalances can be overlooked for those diagnoses as well.
Wow. Yeah, it sounds messy.
It can be.
Yeah, and I mean, you can go and get testing done in regards to testing your hormones. How accurate is that? Are the right tests that we should do? I presume depending on where you are in your cycle, that would be different as well. Like, what are you testing for? Like, oh my gosh, it's so complex. I'm just so lucky I'm a guy and it's like pretty straightforward. So
Though men can start going through andropause, which is the
okay.
male version of andropause, as early as 35. So men have issues, but they don't have the big fluctuations like us women have. You
Yeah.
guys aren't exposed to birth control like many women are. So there's and pregnancies and all of that. So there's not those big fluctuations like women experience, but it matters for men too. But in regards to testing, and it depends on what that practitioner has been trained in. I prefer either salivary testing or urinary testing, because then you're looking at the hormone that is unbound from a carrier protein. So when you're looking at serum hormone levels, you're seeing results that are bound to a carrier protein. So it's not actually what's available for use at the receptor site. And for me and my processes, that's what I want to see. I want to see what's available for use at the receptor sites. And then yes, timing of the testing is a big critical factor in there. And there's a difference in those levels, whether they're in that follicular phase, which is the first part of the menstrual cycle, or the luteal phase in the last part of the menstrual cycle. So there's differences there. And different situations depend on the testing too, whether we're looking for fertility struggles or we're looking for just general hormone imbalances. And then also women who have had a hysterectomy, but they haven't had an oophorectomy, where they haven't had their ovaries taken out, they still have cycling. So I still like to have very precise testing with those individuals as well.
And are you looking at a broad amount of hormones? Are you primarily looking at specific ones?
And it very much depends on the woman, but I always like to look at the adrenal glands and looking at the cortisol levels, because that so intertwines with our hormonal processes, our sex hormone processes. But then I like to look at all of the estrogens, because there are several different estrogen types, progesterone, DHEA, testosterone, and then looking at those binding hormone, the like sex hormone binding globulin, that type of thing can be very, very important to figure out where the kinks are as well.
When you're speaking with someone who does have hormonal imbalances, and you've got the symptomology, you've even got the test results, what conversation do you have around like lifestyle factors? Like, what are the big ones?
It's pretty much the foundation of it all, and I do call it the foundational five. And this comes with any health concern. I feel like you can go back to the foundational five, which is going to be your stress, managing your stress. And I know that's easier said than done when you feel terrible, but having good coping mechanisms for stress, our stressful lives, is very important. Our sleep is very important. And there's so many studies that show that our hormones can maintain a much better balance when we have adequate restful sleep. And that's the key word there, is restful sleep. Because when we don't get that good restful sleep, we can sleep for 10 to 12 hours and still not getting that good restful sleep that's necessary. Then obviously our nutrition plays a big role. Our highly processed foods and sugars and all of that can make a big difference in our hormonal balance. Movement makes a big difference. You don't want to do too much. Those women that I work with that are like cardio queens that want to go crazy on their spin sessions or their cardio sessions, sometimes I have to have them rein it in a little bit and do more strength training or something like that. But we definitely customize in there. But then our relationships also play a huge role, and the quality of relationships and just that connection, that human connection, is very important as well.
Yeah, those foundational aspects certainly could support kind of everybody when you have to like sit down and take a look at sleep, stress levels, exercise, food, nutrition, etc. And yeah, it's interesting that I know at least a couple of people who were those cardio queens, who were also trying to get pregnant at the same time and just couldn't do it for years, and then they just like stopped being insane in the gym, doing like 5 days a week for like an hour hardcore session. Like, how does the body translate that at like, I'm constantly running away from like predators? And then they stop doing that, they chill out a bit, they relax, they go on holiday, and then they get knocked up, and it's just like boom, like right away. It's funny, but it happens because it's
Crazy.
why would the body put yourself in a position to become pregnant when it believes it to be under stress all the time?
Well, that's the thing. If we're running from a tiger, we don't want to be making babies. We don't need our hair. So a lot of those women their hair's falling out. Can't get pregnant, and we don't need those things if we're running away from danger. And sometimes that danger, when it comes to those cardio queens, is a cultural stigma or a cultural kind of indoctrination that we need to go more cardio to lose fat and all of that, when should not be where we're at in this day and age.
Mm-hmm. Yeah, I still think the psychology of weight loss and Weight Watchers and all of that is still like so unbelievably prevalent. I mean, you see the front pages of most like magazines, and
It's 28 pounds in 28 days. And I'm like, ah!
And it's like, would that even if you did have that, was that enough? Like, can you ever be slim enough? Can you ever be thin enough? And it's just like, it's so funny how it's not funny at all, but it's so disturbing that even after 50, 60 years of this, that it's still deeply ingrained in the psychology, especially within women. It's really actually quite fascinating.
It is. And I'll have women that I'm working with, and we're in a big old group chat and everything for those that work with me in group setting. And they're like, I just felt like I needed more cardio. So that's what I'm doing. And I'm like, how about you go for a walk or work on some flexibility or mobility or something like that when you feel like you need more cardio or something. So yeah, it's a sad phenomenon.
Yeah, the deep psyche of wanting what maybe other people have or not feeling enough. And my wife, for example, is honestly the most beautiful woman on the planet, but she still has those insecurities that we all do. And I feel just like for women, it's just like amplified by a million in
Yeah.
regards to that. And it's just super, super stressful, and it's probably constant as well.
Yeah. And I do feel like there is almost this innate push towards things, because think about back in like medieval times, it was actually more desirable to be plump and pale, which meant that you had adequate food and you had shelter. Whereas now we have fast food on every corner, and we're not getting outside in the fresh air, nature, vitamin D enough. And so I feel like it's almost like this weird shift that is pushing us towards being healthy, but some of us take it a little bit overboard.
Yeah, and again, like back to like school and education, which is obviously where so much of this needs to be embedded and implanted and supported and put into a position where people can ask really good questions. Yeah, it just seems like we're just clearly not doing enough with our children, with our teenagers. You can just look at the rates of depression, anxiety, and physical stuff as well. Like it's just like it's quite unbelievable. Like, what would you, if you're a nurse practitioner, you have got a lot of experience with hormones. Do you go into school settings and do you teach teenagers? Do you have teenagers come into the clinic?
I don't have them necessarily come into me, but I have educated youth groups locally on the importance of hormones, primarily the girls, because that's
Hmm.
mostly what I work with. So yeah, I take it to youth groups, and maybe someday I will reach out. My daughter, my oldest, is 12 years old, so I need to be advocating in the schools more often.
Yeah. Do you think parents can do a better job with understanding and answering questions and being open to that? Like, that's probably like maybe an awkward question, an awkward conversation for some parents, but my gosh, like it's so complicated and so complex. And even from young ages, I'm sure we can do a lot as parents with diet when it comes to diet and exposure to different things when it comes to hormonal health. Obviously, we have hormones from birth and probably definitely pre-birth. Um, and there's things that we can be doing without question within the home.
Yeah, and that's when I've worked with a mom that has young kids. She often will tell me, "Oh, I can take this and apply it just in life," and really, I try to tell all the women that I work with, yes, nutrition matters, but we don't want to shift over into that diet culture mindset. And so I urge them, when they are making meals, that you only make one meal, and you explain to your family, no, this isn't about weight loss or a diet or anything like that. I am eating this way because it actually benefits my hormones, like an increase in cruciferous vegetables, our broccolis, cauliflowers, that actually helps us metabolize our estrogen more effectively, so it doesn't sit in there and ferment, like I said. So that's a very, very important thing. So really having that conversation, and I have it with my girls. I'm a mom of 3 girls, and we talk about, okay, I'm eating this because it helps with this. Like my vegetables, we kind of talk about the different vitamins and nutrients that are in each vegetable. I'm eating this protein because that actually helps me make adequate neurotransmitters so that they can flow correctly, so that my moods can be better. So yeah, it's really good to have a conversation and not be, oh, I'm on a diet, I'm on a hormone diet. Even that is, I think, very damaging. But just talking about why specific nutrients are necessary for health instead of restricting.
That's a really good insight in regards to the nutrition element of it all. And yeah, so you're a mother of 3 girls and you're a hormone specialist. That's kind of prime. That's great.
I maybe was like, I'm gonna have a house full of lots of hormones fluctuating, so I better take charge and like get ahead of the game.
Yeah, I bet your Costco broccoli bill's pretty high.
Well, if we lived near Costco, it would
Okay.
be, but we're a little far from Costco, so Walmart is
Well,
what it's gonna be.
that'll do. That's okay.
Yeah.
Um, just thinking about the fact that so many medical professionals are uneducated when it comes to hormones, where would you recommend women go who think that they've got like hormonal issues? Obviously, we spoke about the different symptoms that might come along. They might be quite subtle to begin with, and maybe build up and build up, but they could also fall under the bracket of psychological disorders as well. So they might be um, thinking elsewhere. But if somebody who's got some symptoms, they believe it to be a hormonal thing, and they want to check it out anyway, and they're going to their doctor, like, are they going to get like, pushed away? Are they going to say, oh, you're fine, you're 25, you're healthy, it's no problem? Like, what, that must be a difficult thing for anybody to go. Where do they go and ask for support and ask for questions where they're actually going to be listened to? And it's not common that doctors like being kind of like told like what the diagnosis is, or what patients want. Like, patients being advocates for their own health is not like something that most doctors really like.
Yeah, and that can be such a difficult thing. And I think this, and I've tried thinking back to when I initially got out of schooling and all of that, and when I started, and I do remember a specific conversation from a family practice mentor, that because when you get out of school, there's still so much information and you don't really know how to apply it and all of that. So that's what you're doing in your mentorships, residencies, all of that. And I remember a specific mentor saying, if she's having regular cycles, it's not a hormone issue. She meets criteria for and for depression, so antidepressant medication. I remember distinctly hearing that, and it's not necessarily that I was taught that in school, but I do feel like these phrases, if you're regularly menstruating, you don't need hormonal problems, or if your periods are irregular, get on birth control to balance the hormones. Air quotes there, that will balance the hormones. So I just kind of feel like this is passed down, and then I do feel like there are so many very well-meaning providers out there, but like I said, it's just not taught, so they don't know where to go. So I have made it a big mission of mine to reach out to be like, to family practice and be like, hey, I'm here. I will help. I know that hormones can be a difficult thing. I'm here to help with any hormonal. So I do have a lot of referrals that come from primary care and OBGYNs even, because, and a local OBGYN that we have, she gets asked all the time on, hey, what about my hormones? And really a lot of OBGYNs, their primary focus is reproductive, and like baby care and post-pregnancy, that type of thing. And they really don't have the time or the capacity to be able to research or take care of more specialties, which you would think OBGYN, hormone, like reproductive care, that would be a good fit for them. But really they have a lot that they've got to deal with too. But then I also, because I am here in Utah, I collaborate with primary care providers all over to help them help their people. And I also teach the clients that I work with that how to communicate with your provider so that you're able to advocate for yourself without the provider putting up brick walls and being like, hey, don't tell me what to do, because that can be an issue. And sometimes it is just a communication tweak that can really help people. But so that's one thing. I made it my mission to be able to help women anywhere. And so the testing I do can ship internationally, and my processes and protocols can be done no matter where women live, because like I said, I live very rurally, and so it's not a convenient thing for women to come visit me, but I do everything virtually and all of that. So, and I do have a hormone symptom checklist at checkhormones.com that can help women navigate on if it's worth it to even start diving down the hormone realm.
Well, that's really cool. And that sounds like a much more unique, specific methodology to helping out people, because we are so wonderfully unique, right? And you're never going to have really the same two cases. And it's obviously important to have a standard level of care. But like, if you use the example of, if somebody's got depressive symptoms and the cycle's normal, then you would go to antidepressants. Like, that's just not taking into consideration the individual. And it's really, in my opinion, really, really lazy medicine. But that's kind of all we've got at the moment.
Yeah, and it could be that provider is just so backed up because they're in the 15-minute model, you know, where it's like each appointment is 15 minutes long, and they have to basically conquer that person's world in 15 minutes, which is virtually impossible to get that handled. So it is very complex, and each individual it is very important to personalize it, and everybody's not just a standard protocol.
Have we always had this female health hormone imbalance? Would you call it a crisis?
Yeah, I would, because I do feel like it destroys even families. It can destroy families based on moods and energy, you know, productivity, all of that. I do feel like it's a crisis. I feel like it is increasing in prevalence just because of our environment, our exposure to products that we slather on our skin every day, which you wouldn't think that would affect internally, but oh my gosh, your skin just soaks up so much. And so if you don't feel comfortable drinking your products, you probably shouldn't be slathering it. But that exposure, and then synthetic hormone exposure, plays a big role. And then we've got a lot on our plates. Like, we were supposed to be juggling careers, family, home, like we've got a lot that we're juggling. And so I do feel like that we're in this recipe for a lot of hormonal issues. However, I do believe that women have struggled hormonally since we were, you know, I mean, there were fertility issues in the Bible and all of that. So I do feel like women have struggled hormonally since creation, but it is increasing in prevalence now.
Interesting. Well, thank you so much. I learned a lot, Megan. Really, really appreciate it. Can you let us know where we can connect with you and learn more?
Yeah. Well, thank you for having me. First off, I appreciate it. I love talking about hormones, so I'm always happy to be talking about them. But I am on social media, which I do feel like that's a great place to be able to learn and be inspired and find out new things. So I'm super grateful for social media. Yes, you can get a lot of crappy advice from social media, but then there's like, my mission is to flood it with good. So that's what I'm doing. So I'm on TikTok, Instagram, Facebook. All of those are going to be Megan Bliss NP. I'm also starting ramping up on LinkedIn and Twitter and YouTube. So all of those are Megan Bliss NP. And then my website is just meganbliss.com.
Wonderful. Well, I'll make sure that every single one of those is accessible to our audience so they can connect with you and learn more. But again, thank you so much, Megan. It's such a complex, wonderful issue. Very important that we create content to open up the discussion about these and get these perspectives. So thank you so much for coming on.
Thank you so much for having me. I appreciate it.
Great. Well, that is it for this episode of True Hope Cast, the official podcast for True Hope Canada. We'll be back with you next week. You can leave us a review on iTunes if you feel like it. Don't forget to subscribe, and we'll see you next week. Thanks.